Would PRP help neck? I am 36 with generally good skin, but have one area with quite a bit of laxity on my neck. Would this be something that PRP could help? If not, what are my other options? Thanks in advance.
Thank you for your question. You submitted a photo of your neck and you state you're 36 years old and you have an area of what appears to be loose skin, and you're asking if PRP will be helpful to treat this area. Well, I can certainly share with you the way I counsel patients who come in with very similar situations as yours. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years and helping people with their neck in terms of rejuvenation through a multitude of options is something we do in our practice every day. And especially as significant is our use of PRP in our practice. So I'll help you understand what PRP can and cannot do. So to begin with, the choice of any type of intervention is based on a proper diagnosis and also understanding, of course, the limits of the tools that you want to apply. So we'll start with just first getting a better understanding of what PRP is. PRP stands for platelet-rich plasma. Platelet-rich plasma is essentially a concentration from your own blood of the wound healing and growth factors appropriate to stimulate collagen, to generate blood supply, and have a lot of different things that can do to help tissue essentially improve. So when we use PRP in our practice, we use it for acne scars, we use it for wrinkles, we use it for skin discolorations, under-eye dark circles. We use it in conjunction with acellular matrix for hair loss. Now, a lot of times people feel that or interpret PRP as being able to fill as well as to lift. And in either situation, it's really about a perception. Okay, let's start with the filling part. When you're trying to improve an area's appearance of volume, PRP can stimulate the fat under the skin to blossom and increase in volume, and that can look like filler, but it's not going to be the same as an injectable filler. As far as lifting is concerned, in an area, let's say over the cheekbone, or an area where there is a layer of fat that can help be a cushion and may create some volume subtly, then it can, quote, lift. Now, in your situation, the diagnosis is probably not appropriate to use PRP as a standalone. PRP can help the neck skin texture, it can help the neck skin quality. But without the benefit of a physical examination, what it appears is you have a platysmal band, which is a muscle called the platysma, and that band represents an attachment to the skin. And a lot of times we can interpret this as a splitting of the muscle. Sometimes it's really just localized or an area of atrophy, which makes the muscle more prominent. And so you essentially are dealing with a muscle that there are a variety of options in which can be used to address that muscle. Everything from minimally invasive, such as the use of Botox to relax the muscle, as well as moderately invasive or something like a suture suspension procedure, and more aggressive, such as platysmoplasty and neck lifting surgery. So I think that is more appropriate based on the diagnosis. Now, of course, an evaluation is not limited to the narrow area of the photograph of your neck, but a proper evaluation. When I see my patients in my practice, I take pictures and I have them lift different areas and I show them and review their photos on the screen about what what we can possibly do based on what the issue is, and then they decide what they're comfortable with. Sometimes it's a stepwise approach. Sometimes we do a little Botox first, see how things look. Then if that isn't as beneficial, we look at other options. We look for whether or not there's truly redundant skin, or is there volume loss in the face. And in that case, we could actually do something called structural volumizing to literally expand the volume in the face to help lift the neck. But that's a different strategy, and it depends on your facial anatomy, which you can't appreciate with the photo you submitted. So I think that you will find that you will get a lot of opinions about what's best for your neck. And I think it's important that you get comfortable with a doctor that can guide you in a way that hopefully you'll feel comfort with. There is a lot of options, and there are a lot of technologies that are being promoted, and there's certainly no shortage of people that are ready to offer you their best solution. And I think it's certainly, majority of the time, it's well-meaning, but a lot of times it might miss the mark unless there's good communication between you and the doctor. So meet with qualified, experienced cosmetic surgeons. I think that would be the ideal specialist, is a cosmetic surgeon, someone who is able to do everything from minimally invasive to more advanced cosmetic surgery, to give you an overview based on experience as to what would be best for a 36-year-old woman who has this issue. So I hope that was helpful. I wish you the best of luck, and thank you for your question.